Well, good afternoon or good morning if you are joining us from the West Coast. I am pleased to bring to you this afternoon the introduction of our latest tool from the Center for Community Resilience. I'm Dr. Wendy Ellis, the director from the Center of Community Resilience at the Milken Institute School of Public Health at the George Washington University. We today are unveiling this latest tree to help communities really envision as well as measure positive outcomes for children, families, and communities as we all work to build community resilience. I'm happy and pleased to be joined by some of our most strongest collaborators as well as influential friends in this work to help us both frame hope and resilience and why this is so important in this work as we continue to work towards fostering equity, building hope, and ultimately building community resilience. I'm most pleased to be able to be joined today with Dr. Bob Segi from Tufts University School of Medicine and talking about the HOPE framework, healthy outcomes for positive experiences, which represents a paradigm shift in how we see and talk about the positive experiences that supports a child's growth and development into healthy and resilient adults. Also joined with us today is Tiffany Williams, who is a co-interim president and CEO of the DC-based Martha's Table. During the pandemic, Martha's Table worked with partners here in Washington, D.C. to distribute more than 600 bags of groceries daily to its neighbors. This commitment to collaboration with community is fostering social cohesion, building social capital, and fostering hope. Working with community and demonstrating measurable results is what community resilience looks like. Also joining us today are two of our partners, our longtime partners in the Building Community Resilience work from Cincinnati, Jill Huang from Beach Acres and Bob Shapiro, who is the director of the child abuse team at Meyerson Center for Safe and Healthy Children and executive director of Joining Forces for Children, one of our largest coalition partners in Cincinnati. It's a network of community collaborators working to reduce ACEs, foster equity, and build resilient families and communities. Jill is an innovator and disruptor of the status quo in social services at Cincinnati's Beach Acres Parenting Center. Together, Bob and Jill, with parent collaborators, lead the Parent Connects program that they will talk about today, where they're using the wisdom of parents and the power of social connectedness to foster healing, build hope, and ultimately build resilient families as part of their collective work to create more equitable environments for the families they serve. So this is our esteemed team today, along with my colleagues Connor Hounshell, as well as Sarah Baldoff, who will both work through the resilience tree to show you how to use this, how to communicate when we talk about community resilience to create a shared vision as well as opportunities for measurement. That this is not some amorphous and dream weaving, but this is something that is hard and fast that we can measure and hold ourselves accountable in the communities that we serve. I want to take a moment just to orient some of the newcomers to the work that we do here at the Center for Community Resilience to help you understand the science as well as the experience that all of our tools and resources are built upon. We started our work in 2015 with the Building Community Resilience Networks. They're our national collaborative of teams of community collaborators, state and local leaders who are working together to reduce adversity, foster hope, foster equity, and ultimately build community resilience. Through this work, we have become to understand through our community partners that we must be well versed in speaking to inequity and the importance of fostering equity and facing some of the most harsh truths about our history and about our policy that deliberately drives racial and place-based inequities in our country. And so through that work, we've created a line of tools and resources called Fostering Equity, but also have branched off into doing truth and equity work, place-based, to help community partners understand the place-based policies as well as the history that drives the outcomes that we see today, the negative outcomes. But more importantly, to really work together with community to develop policy and advocacy agendas for long-term policy and systems change. Also working at the systems level, we do this work with local health departments and the Resilience Catalyst for Public Health, a nationwide network of 12 local health departments, also putting equity at the center of their work to begin to disrupt cycles of adversity, foster hope, foster equity, in order to build community resilience. Of course, as you've heard me say over and over, that our work is about long-term systems change. And with that, we have our own in-house policy lab that helps us to translate what we're learning from our partners in real time into policy recommendations, appropriation, and real systems change. We also work very closely with federal and local state partners to help translate the policies and the opportunities into real work in our communities that contribute to long-term systems change. So I want to give you just a moment, if you're on your computer, as I'm sure you are on this Zoom, to download the tree workshops and the tutorial as we get ready to dive in to today's exciting unveiling, but also understanding how to use this new tool. So with that said, I'm going to dive in and we'll get started. So the resilience movement started 6 years ago with really helping the field to communicate the parabases, what we call the adverse childhood experiences in the context of adverse community environments. This was actually our first tool when we came together as a collective, because so many of our partners were really struggling with how will we communicate the urgency as well as how adversity is transmitted within families and within community. But more importantly, to really look at prevention, then we have to consider the context in which these adverse childhood experiences are occurring. And based on that foundational science, that really helped us understand the contribution of domestic violence, substance abuse, emotional and sexual abuse, maternal depression, physical and emotional neglect, divorce, mental illness, incarceration, and homelessness, the effect of that experienced in childhood over the life course. The science was clear that early exposure to adversity had longitudinal impact on children, on young adults, and adults throughout the lifetime. But again, when we looked at the social determinant science, we understood that adversity experienced by individuals did not occur in a vacuum. Oftentimes, these things were co-located with areas of concentrated poverty, individuals who were experiencing racial discrimination, gender discrimination, community violence, those who were homeless or housing insecure, or those who were experiencing a lack of opportunity to educational opportunities, economic mobility, and the lack of social capital. So using this tree, we've been able to help communities communicate and envision and come to a shared understanding of the problems that they were trying to solve. And also the systems, the drivers, the root cause of many of the adversities experienced. And what we learned through this work is that while we can measure many of the things, the systems drivers, the experiences that individuals feel in their lives that contribute to adversity, one of the things that's most important, particularly from a community context, is this balance of hope and fear. And we know this from our most recent events in history, this tug of war between hope and fear. And it's such an important element when we talk about community resilience, that fear is an instinct, that we understand that it is an instinct, a positive instinct, that really helps us to survive as a species. But fear that is not balanced with hope can drive rising levels of anxiety, depression, and anger, and certainly undermine social cohesion. Unfortunately, it doesn't take a lot to foster fear. Hope, on the other hand, is not an instinct. Hope is a secondary emotion that requires nurturing, but the benefits are so bountiful for our children, for our families, and for our communities in promoting health, well being, social cohesion, as well as social capital. And so, at the Center for Community Resilience, when we think about these systems that impact the experiences of individuals that we speak to with regard to the pair of ACEs, we understand that there's a larger ecosystem of housing, of public education, of law enforcement, and criminal justice. And as this graphic shows, there's also a role for hope and fear, that the levels of hope can sometimes counteract the negative impact of fear. That having public education that provides individuals an opportunity to rise above, to bounce forward and thrive, actually fosters hope in this beneficial cycle, this reinforcing cycle of moving individuals forward in community. Opportunities for safe and affordable housing, access to jobs, and economic security, those all foster hope. And where we have hope, we have greater social cohesion. And where we have greater social cohesion, we have greater and increased social capital, meaning that communities are in a better position to actually advocate for those things that will contribute to positive experiences, not just the absence of adversity, but truly positive experiences that help our communities, our children, grow, develop in healthy ways, but also for communities to bounce forward and thrive. And so, with that, I want to share with you what community resilience looks like. That what we're talking about here are not just these feel good things that we can't measure, but actually things that are hard and fast measurables. Measurables from an individual level, but also measurable from our systems. Understanding that the role for equitable and trauma informed systems and supports and the connection to the outcomes that we seek. Again, not just the absence of adversity, but the presence of such important supports that actually foster hope and foster resilience. And so when we're talking about promoting hope in the face of fear, we're also being quite concrete in understanding those policies that provide these positive supports that you see in the tree. And we've seen some of these in the past year. Cash assistance that provide monetary support for families to reduce levels of stress and actually provide time for parents, time and space for parents to support the healthy development of their children. These 2-gen supports that look at not just what the child needs, but what does the child need in the context of that family, of that dyad, that parental dyad, of home visiting programs and the benefits that we've seen in the past year that expanded the access to that, that improved infant well-being as well as reducing maternal depression, that expanded those supports, that necessary supports to promote well-being, mental health well-being. So again, these aren't just measures of the absence of adversities. These are the measures of the outcomes that are associated with positive supports for children and families. Again, measurable results moving from all the way upstream with our systems and our policies to the downstream health and social outcomes, connecting the dots. What our systems and supports are necessary to support and provide healthy outcomes for our children, positive outcomes for their parents and our communities in order to foster hope and build resilience. And so, without further delay, I want to turn the tables over to my colleague, Dr. Bob Segi, who can talk to us specifically about what does it look like to foster hope and resilience in communities.
Wendy, thank you so much. It's always wonderful and inspiring to hear from you. And I want to thank you for inviting me and everyone else to join this panel and to join with you in the work that your center is doing. Today, I'm going to be talking about hope or healthy outcomes from positive experiences. And after this brief introduction for a few minutes, I'm going to sit back and listen and hear about all the work that's going on around the country. And this, I think, is going to be a moment in history where we realize that using the resilience tree brings together so much work that's going on and is such an important turning point as we begin to look at the importance of community resilience and positive experiences, not just the deficits and the problems and the trauma, but what we all wish for, hope for, and our children need. So hope exists. The Hope Healthy Outcomes from Positive Experiences framework exists because we need to help children grow into healthier, resilient adults. And hope aims to better understand and support the key experiences that underline health and resilience. So this comes from many places. One of the origins of this is the work of the Montana Institute that developed the science of the positive. And they note that the positive is real and worth growing. And in our work with them and our other colleagues, we know that positive experiences promote children's health and well-being, allow children to form strong relationships, cultivate feelings of worth and mattering, provide a sense of belonging to your family, your community, and society, and all of these things, building specific skills that help promote resilience. Because let's face it, all of us face headwinds in our lives, and the ability to be resilient is so important, as well as trying to reduce the overall adversity. But even though the science is clear and we know the importance of these positive experiences, many of the systems that we've developed focus on the negative. Screening tools, many of which codify implicit bias, create a presumption of deficit. So it's not unusual for a family to come for their healthcare appointment and be asked about domestic violence and drug use and poverty, a lot of things that they might be ashamed of or not thinking about, but they're not asked about their relationships, about their contributions to the environment and community, about what their hopes and dreams for their children are. So they come in and there's an expectation that they're people who have a deficit. And what we're doing with hope is really turning that upside down. We want to shift the narrative because we know that people are defined by their strengths as well as their challenges. And in every environment where families come into contact with a system that's supposed to serve them, we want to have a presumption of strength to start out that collaboration that will help families. The research part of this started with our adding questions to the 2015 population study in Wisconsin known as BRFIS, or Behavioral Risk Factor Surveillance System. It already included questions about ACEs, or adverse childhood experiences, and we added questions about positive childhood experiences, and then correlated those with adults' mental health. And this work was led by Jennifer Jones, who's now at Prevent Child Abuse America, as well as my colleague Jeff Linkenbach, who I just mentioned. And these are the questions that parents were asked, adults were asked. As a child, up to the age of 18, how often did you feel able to talk to your family about feelings? How often did you feel that your family stood by you during difficult times? How often did you enjoy participating in community traditions? How often did you feel a sense of belonging in high school, feel supported by friends, have at least two non-parent adults who took a genuine interest in you, and feel safe and protected by an adult in your home? And picking up on Wendy's comment earlier about the emotions of fear and hope, notice that each of these 7 items is about a feeling or an emotion as we recall our childhood. And the results were really dramatic. We found that 87% of Wisconsin adults who had 6 or 7 positive childhood experiences also had good mental health, whereas those who only had 0, 1, or 2, only half, or 51%, had good mental health. And just for the sake of simplicity, good mental health is simply not reporting depression or poor mental health. And this analysis was led by our colleague, Christy Bethel at the Child and Adolescent Health Measurement Institute at Johns Hopkins. Um, and we then looked at those Wisconsinites who had a really difficult childhood. They had 4 or more kinds of adversity: child abuse, child neglect, family dysfunction, divorce, incarceration, substance use, 4 or more of those kind of things. If they didn't have protective, positive childhood experiences, 61% reported depression or poor mental health. However, even among those people who had 4 or more ACEs, if they had 6 or 7 positive childhood experiences, only 1 in 5 had depression or poor mental health, a very strong protective effect. And we're now working with the CDC. We have an additional 4 states coming up this year and another state coming up next year to see if we can expand these findings about adult recall of positive childhood experiences. And it's all well and good to look backwards at your childhood. How do you look forwards? And what we did is we thought that positive childhood experiences might lead to resilience and positive health outcomes by preventing ACEs, blocking toxic stress, and promoting healing. And together with Charlene Harper Brown, we developed what we now call the 4 building blocks of hope: relationships with other children and adults, safe, equitable, stable environments for living, playing, and learning at home and in school, social and civic engagement that develops a sense of belonging and connectedness and mattering, and emotional growth. And this really happens through child-centered play and through interactions with peers, where we learn about each other and about self-regulation. This was done with a literature review recently. Guo et al. Looked at a longitudinal study of Australian children and found that this framework holds up when you measure positive experiences of children as they're growing. It protects them when they become adolescents. So we're now working with our collaborators around the country and develop hope-informed care. Hope-informed care is strengths-based. It's child-centered, looking at those positive childhood experiences. In practice, it's family-led, and they innovate around promoting access to the 4 building blocks. And we leave the 4 building blocks really kind of as those titles and ask people to fill in with their culture and their geography and their resources. What does engagement look like? What does a safe environment look like? So it's not for me to say, it's for us to say that children need those safe and equitable environments. And what does that look like for you in your culture and community? And that has been just a wonderful exploration as we've now reached over 20,000 providers around the country. Finally, we found that families are resilient and hope exists to celebrate those family strengths. We've written a number of papers, including information on the American Academy of Pediatrics website about a survey we've done of 9,000 US parents. And what we found was that families were strong during the pandemic and parents adapted to help their children. That parents reported that their relationships with their children were deeper and were positive, even though they faced enormous stress. And what we found, if you look at the data from a public health point of view, is that child physical abuse actually dropped during the pandemic, as opposed to expectations that would increase. And the simple reason for this is that parents love their children, but the lesson is that community support protects families. During the pandemic, there was expanded unemployment insurance. There was a moratorium on evictions. There were stimulus checks. There was the child tax credit. And these things moved millions of children out of poverty. And in addition, we've heard stories ranging from the school principal who told me that he called every child, every one of the 357 children in his primary school, and talked to them during the pandemic. School bus drivers who delivered food on their route because they knew schools were closed and kids weren't getting school. And the army of home visitors who not only flipped from in-person to virtual home visiting, but met with their families more often, and were able to provide them with concrete supports. All of these things, community supports protects families. And from that lens, developing resilient policies in communities resulted in a drop in child abuse, contrary to everyone's expectations. A really important lesson to learn that we can prevent child abuse simply by protecting families. And the reason is because parents love their children. Not that complicated. So we'll invite you to come learn more about HOPE, our website, positiveexperience.org. We have a bunch of resources, the ones shown here in English. We have some in English and Spanish. They range from an anti-racist framework and action for providers to 10 ways for families to promote positive childhood experiences. Have a look around, send us comments. We would love to hear from you. We would love to help you in your work as we're growing HOPE, healthy outcomes from positive experiences. So Wendy, thank you for giving me the chance to explain the HOPE framework and to be here today and to be your colleague and friend. So I'm going to turn it right back to you.
I am so honored to be able to collaborate with you. It's just always so exciting to be able to sit down and listen. Every time I hear you present on HOPE, I can't help but grin from ear to ear. There is a question in the chat before we go to Tiffany that I really would like for you, because I know it was certainly something I thought about when you first shared with me the results of the child abuse study that was taken looking at some of the pandemic data. And it comes from Carissa Bishop. She's asking, could the drop in child abuse be due to underreporting by teachers as a result of virtual learning and no longer seeing children in person?
Absolutely, that's a factor. But what we looked at is first, the reports went down much farther than simply the children not being in school. Reports went down about 50%. Schools account for about 20% of all reports. So a much stronger drop. We also looked at emergency room visits, which dropped, and others looked at hospitalizations, which dropped. And we looked at the surveys of whether parents were spanking their kids. You can't ask them if they're physically abusing their kid, and spanking went down. So we think that all of these data, the simplest explanation is that child abuse actually dropped. And all the data on child abuse is really difficult to pin down. I'm just saying that. But I'm convinced that all of these measures, because they all show the same thing, and because the effect is larger than simply the schools not reporting. But there is one other possibility that I'm interested. I don't know how to look into it exactly. At this same period of time, George Floyd was murdered by the police. And there was a national uprising of concern. And we know that child welfare reports are racially biased. And part of me wishes that maybe abuse reports went down because Black children were not being reported unnecessarily. But that's a hope, it's a wish, I don't know. But I think that the data is very strong that it went down. And there was a question that came in, could it be down because parents were afraid to bring their kids to the hospital? It could be, but it went down so much further. And the most serious kinds of child abuse, abusive head trauma in infants, which is sadly the most common cause of disability and death, those went down by about 40%. So there's no way to explain how everything went down in sync. And I think that the reduction in visits for things like colds and upper respiratory infections was dramatic. However, the drop in child abuse was more dramatic. So there you go.
Wow, thank you for sharing that. And certainly, what we've seen here in Washington, D.C. with our families and some of the work that we did in studying the pandemic's impact on parents in Ward 7 and 8 here in Washington, D.C., as well as in Baltimore, Maryland, in predominantly Black neighborhoods, is that we similarly saw a buffering effect, that fathers were much more engaged with their child's education and daily tending to duties and tasks at home, which really led to this opposite effect that we were hearing in the news with regard to family cohesion and cooperation and a buffering effect for the child as well as the parents. when parents were given the supports that they needed, such as food, such as access to Wi-Fi, and some stability with regard to income. And so certainly, the work that Tiffany and your team has been doing at Martha's Table saw that firsthand, how the immediate supports for families really help to foster hope and build resilience. And so I really want to give you an opportunity to go in depth and share with us what you've learned in collaborating with community to both address immediate needs, but also that long-term work with regard to building community resilience and fostering hope.
Absolutely. So good afternoon, everyone. And Wendy, thank you so much to you and the team at CCR for inviting me to join this very important conversation. And I have to say, even though I have a different role now, I am still an educator at heart, and I love children. So listening to Dr. Sagi today just warmed my heart. I was smiling right along with you. It's just beautiful. So very excited. So Martha's Table, who are we? What do we do? I think it's important as I begin this conversation with you all, is to really just set the stage. And so as an organization, we actually have been around in Washington, D.C. for more than 40 years, and we've been committed to ensuring that there are strong children, strong families, and strong communities. And the reason why I bring that up and why that's important is it's because it's important to note that for us as an organization, it was very important that we continue to make sure that the way that we operated as an organization, the spaces that we operated in, were going to honor the strength and the resilience of families. And so it was very important to us that we come from an asset base and not from a deficit base in our work. And so with that being said, as an organization, and I'm not sure what's happening with my slides right now. I'm trying to see, I'm visually challenged. I'll just keep talking. Don't worry about the slides. And so as an organization, what was really important to us was that we made sure that we were going to put into place all of the concrete supports, all of the social supports, all of the resources that were necessary for families to be able to focus on the well-being of themselves and their children, and to really think about how to move their families from stability to mobility. And so for us, that meant us adopting a place-based approach. And it was very important to us that we said that a zip code where a child lived was not going to determine the positive impact and outcomes for that child. And so what that looked like for us practically meant for us a commitment to some of those tangible supports, high quality education, access to healthy groceries. And that's important, particularly in a community that we're in, where you literally have about 80,000 people and 2 full service grocery stores. So making sure families had access to lots of fresh produce and healthy pantry items, making sure that families were able to build social connections. So when we talk about resilience, the whole notion of a social network of families and other parents and like-minded individuals that you could connect with was really, really important for us. And so we were doing that, and we were very excited about the work that we were doing. We were building relationships with families, with neighbors in the community, and then we were hit by the pandemic. And we made a very intentional decision of how we were going to approach the pandemic. In DC, where there are lots and lots of nonprofits, many of them chose to close their doors. And instead, what we decided to do is that we were going to quadruple our efforts. And it began really with looking at the children and the families that were enrolled in our education program. And so we knew that with the pandemic and everything shutting down, that the 137 families that we were supporting in our school, that many of those families worked in the social sector, they worked in hospitality, and we knew that their jobs were going to go away. And so that meant that we had to make a decision of how we would support those families. And so we introduced cash assistance. And normally when you hear about cash assistance, it actually comes at the local government and federal levels. But what we decided to do is we decided to say for every last one of our families that they would receive $9,000 of unconditional cash assistance. We gave it to them as a gift. We made sure that families had access to groceries throughout the pandemic. We made sure that they had access to transportation, to hot meals, to diapers, to formula for their children. And what we found through that process, when we asked families, how did this support you? families reported a significant reduction in stress because they didn't have to worry about how am I going to pay my rent. We had a lot of families who said to us, it is the first time in my child's life that I've actually been able to just be home with my child and spend time building and strengthening the relationship that I have with my child or with my children. And that meant the most to families. And quite often people don't think about that. Families want to build those healthy, positive relationships and have those positive experiences with their children when they have the opportunity to not have to choose between work, earning a living, and spending time with their children. And so that was a significant shift for our families in that regard as well. And so what that led us to do is to say, how else could we support families? How else could we support the neighbors that we were engaged with? And so we always distribute food. It's one of the core tenets of our work. We have a healthy market. People can usually come and shop. The way you would go shop in a grocery store, you select the items that you like. It's at no cost to our neighbors. And so in a normal pre-pandemic state, in our lobby markets, we normally would see about 1,000 people per month. That's on average. What we found is once the pandemic started, is that number went from 1,000 shoppers per month to literally more than 2,000 shoppers per day. And that was significant for us because many families, many individuals in community who had been caring for themselves, caring for their families, now found themselves in a position where they needed to access food. And so for us, in doing that, we wanted to make sure that it was done in a way that was with dignity and respect. And so the reality is that we all have to eat. And so there was no need for someone to come to us and feel any sense of shame around needing to access food. And it was important for us that even in the midst of the pandemic, that we continue to offer healthy food, because healthy things in produce healthy things that come out. And that was very important to us. So as we're navigating the pandemic, we had the brainchild that we were going to launch a strategic plan. Who does that in the midst of a global pandemic? Martha's Table. We decided to do that in collaboration with the people at CCR, Wendy and her team. And we had the opportunity to speak to more than 1,000 of our neighbors, 1,000 neighbors, returning citizens, seasoned citizens, older youth, parents with young children, Spanish speaking, Amharic speaking. We covered a very wide gamut of neighbors. And in doing that, what became very, very important to us in that process was that community voice would be at the center of whatever came out of that. Our neighbors helped us to design the strategic plan. Our neighbors helped us to facilitate those conversations. Our neighbors, once we collected all of the information that was needed, we brought our neighbors back to the table and we said to them, what's important to you? And our neighbors were very clear in that process. They gave Martha's Table permission to operate in some very specific areas. And there were areas, to be quite honest, where they did not give us permission. And we wanted to make sure that we honored community voice. And as a result of that strategic plan, what happened is we were able to identify 5 key areas that we could focus on, and they gave us permission to. We were able to operate in a space around true and trusted neighbors. What do our neighbors said to us? If you say you're going to do something, make sure you do it. And that's important when we think about resilience work, that you will follow through on the promises that you make to neighbors. It was very important to our neighbors that not only would we do what we said we were going to do, but that also that we would support the work of local organizations who had been doing work in community for years without the resources that they actually need. Many of the people in this community are grassroots organizations that pull resources out of their own limited resources to support the well-being of their neighbors. And so that was really important, that we support grassroots organization. And so that was that. We also were told that it was very important, especially in the midst of a pandemic, when people needed to retool and have opportunities, that we would actually support moving families from a place of stability to a place of mobility. And the engine that you use for that is economics. Money solves a lot of problems. It may not make you happy, but if you don't have to worry about where am I going to sleep, how am I going to feed my family, how will I have my transportation needs met, it reduces a lot of stress for families. So economics was a key part of that. Then we also have heard from our neighbors, how can you make sure that we're successfully helping to support transition older youth into adulthood? In the community that we stand alongside, the majority of people, about 54% of our neighbors are between the ages of 18 and 24. And so they asked us to have some concerted efforts that would focus on that. And then the other two areas centered around emotional wellness, and that's come up already in the conversation. How could we make sure that people could have access to both formal and informal wellness opportunities so that they could be well, mind, body, and spirit? And last but not least, they asked us to pay attention to safety related, trauma related to community safety. And so how would we, not necessarily doing it ourselves, and many of these things doing in partnerships with other organizations, but how would we stand alongside our neighbors as they were able to make decisions and really think about what is it that they wanted to have in their community? And so what that led us to do as a result of that was we pulled all of our information together that we heard from our neighbors. And then we had the opportunity to come back to them after our board approved the strategic plan. And we presented back to them what we were going to do. And what we heard from our neighbors was remarkable. And what they said to us is they said, oh, wow, you actually listened to us. You paid attention to what was important to us, and you responded to what we said we needed and wanted in our community. And that's so important because it is important for our neighbors who are already resilient in many ways to be the leaders and the champions for what happens in their own communities and in their own lives. And that was significant for us. That led us, after we had that conversation, they were blown away. So literally we presented it and we said, who would like to join us in co-designing the implementation of the strategic plan? And every single neighbor that we presented to signed up. And that gave us the fuel that we needed to go into a place where we shifted internally as an organization, honored that community-led initiative, honored community voice, and invited our neighbors to the table with us to co-design the implementation components of our strategic plan. And the first one that we were able to do centered around money. As they told us under True and Trusted Neighbors, by the way, put your money where your mouth is, right? And so we did that. And we formed a community impact fund. What was amazing about that is that we invited those neighbors who were interested in economic mobility to come to the table, and they literally said, we wanted to focus on this group of people for this period of time, this amount of money, this is who we want to review the applications, and we honored that. And so the Community Impact Fund that now is up and running, I think at this point we have over 100 local nonprofits, grassroots organizations in Ward 8 that have started the application process. They are going to submit that application. Each person can receive, we're giving it out to 10, up to 10 organizations, up to $10,000 each. And our neighbors are actually going to be the ones to review the applications. Martha's Table will not make the determination. Our neighbors will make the determination on which grassroots organizations they want to stand alongside them. And so I say all that to say that for us, what has been most important in this entire process and thinking about resilience is building those social networks, making sure that we can create opportunities for families to access concrete supports, including cash, to reduce stress, creating spaces for families to connect with their children and build and create stronger bonds. And also at the end of the day, trusting that our neighbors know what is best for them. And our role as an organization, as a nonprofit, is to stand behind and alongside our neighbors as they make those decisions for themselves and for their families.
Tiffany, I mean, imagine that, first off, starting with trust and what you're able to accomplish, addressing basic needs, economics, as they said, put your money where your mouth is. And so I really want to applaud your group for not only being there as pinch hitters when the community had an acute need during the pandemic, but really standing side by side with community members. I love the quote, "Oh, wow, you listen to us." You listen to us, prioritizing the issues based on the feedback that you receive from community, and then co-design. The co-design work is so important. Again, these are all elements that you will see in the resilience tree, that working side by side with community, fostering hope, building resilience in a way that is meaningful for that community, defined by that community. So really fantastic work, and as always, we're just so proud to be a part of your network and joining in this work together. So I want to turn this over now to our partners from Cincinnati, Dr. Bob Shapiro and Jill Wing, who also have excellent examples of the possibility of change and impact when we listen to our families and meet them where they are.
Well, Wendy, thank you so much for introducing us and giving us a chance to share the work that we're doing in Cincinnati. We have been a BCR partner for not quite a decade, but it's getting to be close to that. And the work that that you've shared with us and helped us along has been really impressive and helpful. In Cincinnati, we decided to address the issue of improving child outcomes by attending to adversity, that a collective impact framework would be most helpful. And collective impact is an organizational framework that's used to tackle deeply entrenched and complex social problems. And one of the beauties of collective impact is it really allows a framework and creates a way for many organizations to work together to address the same type of problems. We recognize in collective impact that no single program, organization, or institution acting in isolation can bring about large-scale social change on its own. For change to occur, there needs to be a concerted effort of the many different players around a common agenda. And much like we were hearing, Tiffany, with your tremendous presentation, this includes community members. And we have been working to bring community members into the solution. And we found it to be a challenge for us that we're just now getting a better handle on. What brings us all together is this theory of change, that early childhood experiences have a powerful impact on health and brain development. And that when adverse childhood experiences trigger toxic stress, the resulting biologic changes lead to learning challenges, behavioral health problems, and physical illness. But that when we reduce the impact of ACEs, we boost child well-being, health, and success. And when we started this initiative, we really didn't know how to reduce the impact of ACEs. And in fact, we were mostly thinking that it was reducing adverse childhood experiences within our community. But we have since learned, with the help of leaders like Dr. Segi and with Wendy Ellis, that by promoting resilience, hope, and positive experiences, we can reduce the impact of ACEs. And so within Joining Forces for Children, we have three priority areas. One is to increase the understanding in our community about current research and strategies to mitigate ACEs and to promote resilience. The second, and BCR has been so helpful in this with us, is to advocate for systemic solutions that advance practices and policies to reduce community ACEs, create an environment of equity, and foster family and community resilience. And lastly, and this is the priority that we're going to be talking about for the rest of this presentation today, is how we partner with community to promote the implementation of strength-based, trauma-informed practices. So Joining Forces for Children addresses and thinks about our community within four different groups. One is early childhood. And two of the programs that I'm just going to highlight on this slide is our Family Wellness Program and our Messages of Hope program. And these are not initiatives that were developed by the Mayerson Center, which is where I work, but in partnership with the Mayerson Center and community providers. And these programs work to improve outcomes for young children by um, increasing the capacity of early childhood providers to recognize adversity and to provide supports to families to lessen the impact of ACEs. And the messages of hope have been a series of 5 tip sheets that have really gotten some great traction within our community and are aimed at parents to help them strengthen the parent-child relationship. And within our school age work, we've created a self-paced online training for K through 12 educators to teach them what it means to be a trauma-informed classroom and how to avoid re-traumatization, recognize trauma, and improve outcomes for kids in their classrooms. And we also have a community partner who has created a series of videos for parents on how to teach self-regulation tools to young children. We also work with our community partners. I believe that we're going to talk a little bit about this in the last 15 minutes, where we recognize that community neighbors and community members don't necessarily relate to the science of ACEs for sure in the way that in healthcare we do. And so we thought that we should work with community members to identify what kind of ACE messaging and resilience building tools would be helpful and appropriate within the community. And they have really created some amazing communication tools. And also with the help of Wendy's group, we have initiated racial healing circles within Greater Cincinnati with the aim to promote racial healing and equity. And so by way of introducing Jill Huang, who is leading this program called Parent Connects, which embeds parenting specialists within primary care practices. This is an initiative that we hope to, and that we have found actually works to build resilience within the families of the pediatric practice. And we have some data that I think is going to be coming out in the very near future to show that actually we have been building resilience in those kids as well. And so let me hand this over now to Jill Huang.
Good afternoon, everyone. I'm excited to be with you and share about Parent Connect, an intervention that is near and dear to many of our hearts in Cincinnati. We know that caring adults have the power to make an incredible difference in outcomes for children. Warm, nurturing relationships between children and adults in their lives are the most important factor in developing resilience and overcoming potential negative effects of daily stress and potentially chronic stress. So in 2 different studies conducted by Beach Acres Parenting Center in the Cincinnati region, we uncovered that whenever parents are experiencing challenges or their child is potentially having some mental health symptoms, they say their pediatrician was a top go-to. So we thought, well, okay, let's talk to Bob about this, who's a pediatrician, and let's see what happens when we go into healthcare where parents are. So what we found is pediatricians, minute to minute, visit to visit, are answering parenting questions ranging literally from potty training to porn, minute to minute, coming their way. So the challenge that we identified in working with some of the pediatricians and really listening to them and listening to their needs was that, you know, they got some training in how to engage families and how to work with families, but they really don't know how to support these social needs that are coming their way. A lot of times they use their own experience, or they may just try to figure out how to get this parent back on track. And so we introduced a potential solution where we would partner with the pediatricians and the practitioners in a pediatric office and be of that practice, not just in it, really part of their team, where they could do a handoff. They could do what they do best, which is medical care, and they could hand off to our parenting specialists whenever it is something beyond the physical health and treatment of that child. Something to do with parenting, child development, challenges, or stress. So we use a proven model that was developed by Beachacres Parenting Center called Natural Strength Parent Coaching. So we're not doing therapy, we're not diagnosing and treating, we're using a very positive parenting approach to really support families. And we have been designated evidence-based by the Centers for Disease Control because our approach gets really consistent results. So you might wonder what our results are. They're all about resilience, all of it, which is very exciting work and very exciting to see. Overall, we see parents are more resilient, more able to raise capable, caring children as they become adults. So in just 3 sessions, we're showing change in some key factors that really affect the parent's life, but also that child's life. Their role satisfaction is improving, their confidence as a parent is improving, their relationship with their children is improving, and they also are taking some time to pour into themselves, which we know is so important for resilience building. Self-care is really key and crucial. And for parents to be selfless individuals, selfless folks, and to be able to take time to pour into themselves and understand the importance of that, it's a wonderful thing. So we see these results just after 3 sessions, and then we also look at again in 3 months post-exit from coaching services, and we see that these results are sticking, which is phenomenal. So what do we do in this program? Well, we have a questionnaire where we ask at well-child visits some questions about parental stress, about child development, about needs that they might have. We do ask what's going well also, to what Dr. Segi was talking about. We then have dedicated parenting specialists who are there to collaborate and support the pediatricians and the health professionals in the office, as well as the parents that come their way through coaching. Those one-on-one meetings, typically families meet with us 4 to 6 times, and they may return when another challenge arises, or they may be able to use the skills that they've developed or the positive parenting techniques they like in the future when other issues and other stressors arise. And then we obviously do some unique things for different practices as requested, because we work with a variety of different practices within our region. So we have had some publications. Bob mentioned a few things, but what we have found is parents love this. It's easy, it's helpful, and it's one thing that parents think, wow, this is something that I can do for myself that will help my whole family. Many come in skeptical, thinking that they're a bad parent who has no idea what they're doing, and they quickly find out from our specialists that parenting is hard, like really hard, like really, really hard. And they're able to really approach our folks with the needs they have, and we reciprocate with no judgment. So you might wonder who's on this team? Who do you use to do this? Well, you see a picture of a few of our friends, all their friendly faces. And this is a group of folks who have a lot of different specialties, who work with families and have a lot of experience doing so, and understand the power of hope and resilience. So if you'd like to learn more, we'd be happy for you to connect with us. Contact information will be in the deck. Feel free to reach out, but we are very excited to be part of this presentation today. And we're excited to be part of Joining Forces for Children in Cincinnati as we look to lift up the hope and resilience in our community. So thank you. I think we're handing it back over to Wendy.
Thank you so much, Jill and Bob, for that presentation and the work that you all have been doing. Yes, Bob, it's almost on the other side of making a decade here of collaboration. So, and we're none the worse for wear. So I want to, really highlight some of the things that you've seen thus far from our community partners who are translating in real time this idea of what community resilience looks like, but also operationalizing hope. And that is, as Jill and Bob show, parents helping parents, using some of the system supports, actually some of the policies to make sure that there's equitable reimbursement and payment for that work. So it's not volunteer work, but this is quality work that's going into the community to support parents, as well as what Tiffany highlighted with regard to community, building solutions, community, and forming our priorities. These are things that are in the soil of that resilience tree, of the soil that that resilience tree is planted in, systems working with communities to produce positive outcomes with families and with children. And so it is my pleasure and actually honor to turn this over to Connor Hounshell from our team, as well as Sarah Baldoff. And I want to embarrass Connor a little bit here. Connor's been a graduate student working with us for the past 2 years, is graduating and will be joining our team full time. We're so excited about that. But Connor actually led the effort to translate all of the work that we've been doing with community for the last 6 years and help us create a tool to visualize resilience. So when you're looking at the CCR resilience tree, I just want you to recognize that that is much of the ambitious work of Connor, our stellar student, as well as newest team member, Connor Hounshell and Sarah Baldoff. So without, now that I've thoroughly embarrassed you, why don't you move forward?
Yeah, I'm worried I'm turning red, so I apologize. But thank you, Wendy. That is very kind of you. And again, I have some great resources that we started on of the work the Center for Community Resilience has been doing. And then it's so great now to see our partners putting this work into practice. So I will go ahead and share my screen. So you guys are able to see my slides. Great. So again, I just wanted to say thank you to all the previous presenters. We were able to hear Dr. Ellis and Dr. Segi guide us through the shift from adversity to positive resilience-based framing and the importance of this for health. And you've now heard about the amazing work of the two of our partners that are putting this resilience strength-based approach to use. And the first thing I wanted to highlight is just how this work is happening in two very different communities. So we have Martha's Table happening in Washington, D.C., a historically blue district, while then we have the Joining Forces and Parent Connect work happening in Cincinnati, Ohio, which is still a blue city, but has recently undergone recent political changes and is bordered by many red districts and communities. And so we highlight this to show the ability of this tree to be adapted to a variety of communities and used to create the shared vision for change, as well as garner that political support from stakeholders to implement this change, and using those aspects of measurement and accountability to guide that process. So looking at the resilience tree that we presented and showed to you guys a couple times, again, we're focusing on this framing from shifting the framing from a negative adversity focus to a strength-based positive childhood experiences and resilience building focus. And so as I went through this process and as we went through it at CCR, through many meetings and conversations, we realized that sometimes this process might feel counterintuitive. So as our systems and our mindsets are currently built to measure and address adversity. So for example, when we were creating this tree, we had to consciously think about not talking about the reduction in adversity, such as parental stress, but instead the factors of building resilience, such as enabling parents to be able to nurture these healthy relationships with their children. And so as we looked at adversity, we then looked at the connected systems and supports and then the outcomes that we wanted to see in community. And we wanted to keep these buckets pretty broad so that the tree could serve as a guide for individuals like you and in your community, not be too prescriptive, but allow individuals to adapt it to their community. So we again acknowledge the challenges of shifting our mindset. And so we hope to present you examples of the resilience tree for the programs that were just described of Martha's Table and then Joining Forces and Parent Connect. And we look forward to seeing how you guys will use these tools or this tool in your community. So I'm now going to pass it on to Sarah Baldoff to describe our example resilience tree.
Thank you, Connor. I'm really excited to be here as well. So we will now dig in. Connor and I have crafted a sample resilience tree, starting with Martha's Table in Washington, D.C. And I think you'll notice that just like its companion, the Paravasis tree that Wendy referenced and many of you are familiar with, the new CCR resilience tree is here to tell a story. And it's here to help you tell the story of what resilience and equity can look like in your communities. So shifting to Martha's Table here, getting into some of the details, Tiffany really explained the very intentional process that they have been going through. It's so impressive to hear about all the details and the language that was used. I mean, I wrote some of these things down, gave us permission to, true and trusted neighbors, follow through. I mean, just kind of, we're all talking about shifting to an asset-based mind frame. And just hearing you talk, Tiffany, is like you're walking the walk here. But you'll see the story of this tree is about developing a shared understanding with new neighbors. And at its core, it's about hearing the community narratives around their challenges and adversities, but also very much their desires, their resource needs, the opportunities, and their strengths on the path to building equity and resilience in a very measurable, tangible way. I think you also, it was clear you heard their intentionality around centering community in their programs and their practices. And this is about supporting citizen leadership, developing and connecting and building social supports, and very much respecting the community and neighbors' sense of place. This is their neighborhood. And all of these elements, shared understanding and centering community, these are the fundamental core elements of our center, the CCR Center's building community resilience process. So this tree, the Martha's Table tree, tells a story of intentionality and processes that they're building out. Their commitment to community-driven policy, which you see in the soil there, centered in the middle, anchoring this tree. Also in the soil are some key structures and supports that Martha's Table has created in their organization. Importantly, they co-created these things, and that was very clear as Tiffany was speaking. This investment in grassroots organizations, put your money where your mouth is, it's a process they implemented. It's bolstering assets already in the community, which is, again, part of the resilience framework of strengths-based approach. Building upon, networking, connecting. And then if we look upward into the top left corner there of the tree, you see, I'm sorry, maybe not the top left, but just in that, by that orange leaf on the left there, neighbor-led community impact fund. This is creating a process and a structure. And really, this is about power as well. This is about putting the power and the purse strings, they're literally held by the people, by the neighborhood. And then community design team, just above that. This is, again, a positive outcome, a process created that is embedding the neighbor's decision-making power into Martha's Table's programs, policies, and practices. And it's anchored, again, by the community-driven policy. It's an example of the way Martha's Table is nurturing social cohesion with its neighbors. Through this design team, they're building a collective vision for change. And above that, up top left, you heard this powerful quote which Wendy reiterated, "You actually listened to us." This comment from the neighbors when Martha's Table came back around with concrete actions and processes responding to the stated interests and desires of the neighbors and community. And this is an illustration of the way Martha's Table is supporting the growth of neighbors' social capital. That is, the power they have is being formalized. The resource decisions they're making is feeding trust, and trust kind of supports this cycle of resilience and equity building. And if we drop back into the soil, Tiffany talked about the cash assistance they're providing. And then if you go back up to the top right-hand corner, the tangible measure that came out of this, or one of them, is that parents have greater bandwidth. They have peace of mind. They have time and space to be nurturing and supportive to their children, growing these relationships. And that ties again to one of Dr. Segi's building blocks of positive experiences. Just below that, next to the right-hand leaf in the tree, this is the access to a basic need, reliable access to healthy food, which again came out of listening to the neighbors' expressed needs for this particular resource. Again, tying back to a basic need in Dr. Segi's building blocks about this is an element, having basic needs met helps support equitable, stable environments. And then to round it all out here, we have, the theme, the underpinning, excuse me, desire by community and Martha's Table, the intentionality around creating pathways for stability and mobility. Again, the central comes back to the central anchor in the soil of community-driven policy. Now we can shift to a different tree that, again,
Sarah, before we shift to the other tree, I just want to point something out here and what we've been stressing so much in the work here at the Center for Community Resilience, but also what Dr. Bob Segi shared with us, is that, again, while we talk about and use these terms around hope, around community resilience, that can sometimes feel amorphous and just feel good, that what this tree actually helps you to articulate and begin to envision are these frameworks that guide us to metrics, to hard and fast measuring of this work. So while we are listening to these inspirational stories, we're also pulling out things that we can measure our success. As Sarah pointed out, with regard to the levels of positivity within the household, that again points to these building blocks that Dr. Segi spoke to. This helps these coalitions begin to think about categories for measurement, categories for accountability. And that is so important when we're talking about measurement of moving towards resilience and hope, and not just the reduction of adversity.
Thank you for pointing that out, Wendy. And that just builds on the kind of fact that what gets measured gets done, which we talk a lot about at the Center for Community Resilience. And so this is providing you a means by which to talk about measures and to pull out indicators of change, positive change. Okay, so we can go to the Cincinnati slide that Connor and I have created. You heard a lot about the story of intentionality around practice change and service delivery. That's what the story being told in this tree is about. And here we feel it's really anchored by this trauma-informed training and holistic family care there in the soil. The focus on the adults and the education and pediatrics healthcare settings, which you can see. Now, if we link here to the left-hand upper left-hand side here, increased parent and child health and well-being. We heard Dr. Shapiro talking about the family wellness programs in the early childhood centers, screenings, resources to support families, compassion, all of this with sort of the shift, the very intentional shift to give the adults who are working with kids, treating kids, teaching kids, this trauma-informed skill set. Again, back to the not what's wrong with you, but what happened to you? How can I support you? How can we make these connections with you and for you? Dropping down there, the building emotional self-regulation skills. This, I believe, was in the Calming Caterpillar program. This is essential skill building. And again, ties to Dr. Segi's emotional growth building block for positive experiences. And Connor, feel free to chime in. I'm not meaning to leave you out here. Let's see. So dropping down again to the improved student success and child literacy. This is all held together and supported in the soil, these structural changes with trauma-informed training for the adults, supportive schools, the environment shift in the K through 12 educator, and then again in the early childhood and education in the Head Start centers, messages of hope, this positive framing fed with actual parenting, tangible supports. Here, back into the soil, we're going to shift into the Parent Connects program that Jill was speaking of. And again, the language being used, asking parents what's going well, this positive framing, providing the social supports and actually embedding a new role. This is a structural change. It's a service delivery change. So the the docs and the nurses can provide the medical care. And as we know, parenting is about so much more than medical, physical health. So, and I think that Jill may have mentioned, but it was in the slides here about the ability to change and fully integrate, add to, and read the electronic healthcare records on the part of the parenting specialist, which is a huge and significant practice change. Having that ability to not only see, but respond to and add to the sort of history and description around that child and family. And then if we look into the soil around the racial healing circles and the community ambassador program, we have connections there to equity up in the tree, increased shared understanding around race and racism. That's feeding into our shared understanding around and social cohesion across races, experiences, lived experiences. And then the creating shared language around ACEs and health equity. This was through the community ambassador program, and it's sort of diving into community narrative there. So we will keep moving along.
Yeah, and I just wanted to add one thing that I thought was interesting seeing across both programs was this idea of the parent-child relationships, and obviously something that Dr. Segi highlighted in his work, but both of these programs focus on the idea, and I think Tiffany put it best, of allowing parents to parent. And so when individuals are given, caregivers are given that ability to invest and nurture relationships with their children, I think there can be some really positive outcomes that come from that.
And now we will sort of quickly link and describe the worksheets. This is the how-to that we have now provided, these new resources. And the links you'll see there at the bottom of the screen. We have this double-sided worksheet that will help you in your communities both work with the pair of ACEs tree there on the left, and on the flip side, we've got a worksheet for you to create your own resilience tree. Next slide, please. Now we'll focus more on the community resilience side because this is new, and we've got the questions bigger on the right-hand side here that are on the worksheet. The idea here is that you can use this tree both to tell a story, to build your coalition, because as you work through these worksheets with a range of community members, professionals, folks who can do data processing, folks with lived experience, you're going to have a much richer description of community strengths, because again, we're focusing on assets, social networks, what assets are in place, systems and supports. We've got these structures that exist, but how do we support them and connect them to make them more cohesive? What would our community look like with opportunities that foster hope, equity, and resilience? This is the space where you can really brainstorm around aspirational goals to build resilience and equity. Who should be at the table? That's an essential question we repeatedly have to ask, because as we dig deeper and develop a shared understanding, we start to learn that there are people who know things that we don't, and they need to be invited to the table to help co-create. And finally, what gets measured gets done. This is the aspect, this is the part of the worksheet where you're really going to dig into finding those indicators that are going to help you measure positive change and success across time. And to Connor's point earlier, this may feel counterintuitive because we're used to talking about deficit reduction, but this is about seeding the positive and building on strengths and connectivity.
Yeah, so I think Sarah highlighted again that this isn't the easiest process, and this idea and this shift from an adversity focus to more of this resilience focus. So we're wanting to share these resources with you all to make sure that you can use that worksheet and this tutorial to help guide you through this process and to make use of this tool. And again, we're excited to see how you guys will adapt it to your community and see what it looks like to create that shared vision for change and promote change in your community. So I will now hand it back to Wendy, and I believe we'll do some Q&A.
Thank you so much, Connor and Sarah. And just from some of the comments that I've been getting from folks who I know in the field on my phone, I'm really excited to see this tool being embraced. It is so important for us. And as Sarah mentioned, it is oftentimes counterintuitive to really talk about the measurement of a positive outcome, particularly when we're messaging and doing these calls of action, to really get folks to rally around positive change. And we hope that putting this worksheet out there doesn't diminish the urgency of adversity that we need to address, but it also gives us instead this opportunity to frame, if we are actually successful in the reduction of adversity, what will our communities look like? What are those positive supports that are necessary to be in place to create a cycle of positivity, a cycle um, of resilience and hope? And so I'm really excited to be able to unleash this to the field and also get feedback from all of you on how that will apply. I think I want to ask Bob and Jill and Tiffany, what was your reaction to see your outcomes, your process outcomes, really captured in this way to communicate the positive outputs and impacts of your programs?
Wendy, I thought it was a great way to visualize and categorize and understand the work that we're working to accomplish. It might, it's a wonderful communication tool. I think it also helps to place greater or create greater understanding of the theory behind what we're doing, the why we're doing, and can also use to identify gaps, I suspect.
I would say for me, two things stand out. One, visually, it shows the level of intentionality that we have made around centering and recentering community voice and community power. And I also think for me, when we talk about measuring, it's a very easy to look at and reflect and see, okay, if you have said that you want to have these things in place, are you doing that? And I think the tree is an easy way to say, hey, how are you doing against the things that you've committed to doing in order to have the impact and the outcomes that you're trying to have? And so for me, those two things were very, I was literally like, oh, wow. I was like, I got to show these to my coworkers. So very exciting. So thank you for displaying them that way.
And I just want to add, I love the theme of parent-child relationship, being just kind of across. I think it is an important piece that is taken for granted sometimes. I also love looking at what's beneath the soil. I mean, that is so critically important to our work, and that we keep that in the forefront of everything we do, because we've got to remember it's not just what we see, it's what we don't see that's is equally or more important. So I appreciate the visuals. I thought they were phenomenal.
Bob Siggy, I see you came off mute.
Yeah, I just love this tool because look at these programs that are so different. And now we can have a conversation about them, because I'm so used to seeing everything evaluated and thought about and talked about in its own terms, which is fine and where you need to start. But now we can have a real conversation about the soil and the outcomes and what we're looking at. And there are a million ways to get there. There are lots of different kinds of trees. But at least we know we're in a forest. And until today, I didn't know if I was in a forest or in an ocean or out in space. Who knows? But there's one thing I want to comment, picking up on something that Jill said. Yes, it's about relationships, but one of the things the tree shows is it's also the environment. So if you think about what happened during the pandemic, relationships between parents and children, between parents and each other, and parents in the community were really powerful. But the environment, where there was a child tax credit, there was an eviction moratorium, there were organizations like Martha's Table that really stepped up to help families, made those relationships possible. It wasn't that anybody said parents don't want to have a relationship. It's you have to have that environment. And I love the soil and the tree analogy because it keeps it from being all on the parents, right? Like, yes, you're working 3 jobs, and yes, you're fearing eviction, but the most important thing you have to do is smile at your baby 17 times a minute or whatever it is, right? That's too much, and it's not putting parents in a position where they can do what they really, 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 really want to do. And I love the tree because it pulls all that together. And I've been taking notes about Parent Connects and about Martha's Table and the things they use. And it's just wonderful to hear all this great work. So thank you for bringing us all together. And don't forget that the soil matters, as Jill said.
Yes, thank you so much. And I want to recognize a question from one of our collaborators here in Washington, D.C., Cynthia Greer at Trinity Washington University, who thought it was really important that we talk about some definitions around resilience. And so those of you who have followed the work here that we do at the Center for Community Resilience, most importantly, it is not just merely a definition that is looking about the ability of individuals to bounce back after suffering adversity. That is a strict definition from physics, which we do not apply to the human spirit. But we recognize from the work of one of my sheroes, Dr. Ann Maston, who really helped us to understand what is necessary to promote resilience in children, particularly after being exposed to abuse and neglect, is having that supportive adult, a safe and stable environment, access to food, access to education, and a community environment that is also nurturing. And here at the Center for Community Resilience, based on that science, but also the science that we've done with regard to responses to disaster and terrorism, we've understood that for communities to bounce back, what actually predicted that was how stable, how safe, how nurturing they were before the incidents of adversity. So stringing all of these sciences together, it's important to understand that this mythology of resilience, that is something that just springs organic from individuals, is just that. It's a myth. It is the American myth, in fact, and it's harmful to our communities, to our children, and certainly to our parents to think that this is just something that merely you have to pull yourselves up from your bootstraps. Both the foundations of hope, the building blocks of hope that Dr. Segi has outlined, as well as our framework of community resilience, reinforce context. Context, environment, and systems matter. And so we hope that with this resilience tree, with these tools, and with the conversations that you can have in your community, you can better articulate both what are the outcomes that we're trying to achieve, what will it look like when we achieve resilience within our communities, but most importantly, what is the soil that our community is planted in? What are the systems? What are the supports necessary to produce healthy, resilient, hopeful, and equitable environments? So we hope that this tool and our stories inspire you and help you identify the partners and the opportunities to build community resilience. Thank you so much for joining us today. All of these tools and resources that we produce are always available for free, downloadable from our website. This recording of today's webinar will be on our website as well for you to go back, listen to the highlights, take notes, and hopefully be inspired. I want to thank again all of our partners, Dr. Bob Segi, Tiffany from Martha's Table, Bob from Cincinnati, as well as Jill, and Connor, congratulations on your graduation, and Sarah Baldoff, who's been a longtime partner of our center, and all of the behind-the-scenes support that you do in the community every day to build resilience. So thank you.